So I think the thought was, well, it may be something new, but we'll contain it, or it won't come. It won't be a problem. It'll be like the H1N1 or the swine or some of these other ones that have propped up, but not been on the level of a global or worldwide pandemic like the 1918 flu was.
Everything else we've gone through, we're fine. We had Zika and we got through it. And I'm not just talking, Zika was just local in Cameron County, but, I think as public health nationwide, we had gotten through it.
In the past, we've always been able to go to the CDC, mm-hmm. right? The CDC, a world leader, they got all the experts. Let's hear what what they're recommending and process the information. But then this time around, it was a bit different.
We started seeing, numbers of people, scores of people getting sick, and there was a lot of concern. Do we cancel? What can we do? And at the time, we were trying to figure out what we could do, what was within our scope of authority as elected officials to address a public health emergency. Obviously, if this was a hurricane or flooding and things of that nature, we had some experience dealing with that, but this was kind of a new area.
I think it was just unpredictable about how much disruption it would cause in everybody's daily life and family life, and the uncertainty about the future.
Honestly, I had no idea we were going to get to this. I didn't think in a million years that we're going to deal with a pandemic. I've been in public health 20 years. It's something that you always think about, but you just don't think it's going to happen.
This is the first time we've had to deal with a pandemic anywhere, and it was surreal in the fact that we constantly never got days off, constantly working, constantly dealing with everything that you can imagine. Because remember, during this time, we also had disaster declarations for rain. We also had disaster declarations for a freeze. So there was a lot of things going on at one time.
We lived through a pandemic that we've never seen in our lifetime. It was difficult because we did put in so many hours and there were so many different challenges. But also on the personal side, not being home to see your children and your family was a little bit difficult. But we understood coming into our jobs that that's what we're here for, right?
It takes a certain kind of a person to be public health, from myself to the employees, You're in for a surprise every single time. Every single time we've had to deal with something, it's like, surprise, you learn something new every day. I wish people would realize that we're not here to tell people what to do. We just want people to do what's best.
When we got our first case, I remember we were all getting ready to leave and we got the notification from our LRN. Those days were long. I remember that first day we stayed till midnight because we had to contact everyone that this person had contact with. And then slowly it just continued with the cases rising. Back then, the preparedness program, I think we were only 9 to 10 employees.
I was consistently worried about my staff. Sometimes I feel like if I feel my staff dealt with a lot, I can only imagine hospital nursing staff, they saw it. They dealt with it. I can't even imagine what they do.
We worked together for 2 years straight. For 10 hours, 12 hours, we worked clinics together, saw my work family more than my real family. But we were here to do anything and everything that this county asked.
And then all of a sudden it became this political issue, which to my, in my personal opinion, I still think has been one of our biggest mistakes as both a country and as a world, and how to deal with this, because the health professionals, the scientists, the researchers, they're the ones who we always should be relying on.
I wonder today whether that would have been different had those factors not played into this. And by that, I mean, had this just become a public health issue and people left it as a public health issue, it had not been politicized. I've always wondered what would it have been like had they just let the public health professionals do their job.
Because the information started getting really garbled, you couldn't trust it. And then the other huge thing was how much we had to interface with the hospitals. Seeing the effects of an overwhelming number of patients on the hospitals and how that trickled down to every other illness that we treat. Suddenly, you're questioning whether you'll be there to treat a heart attack or a stroke or cancer. That was something that we had never experienced before. That I didn't really appreciate until that time, about how fragile the system is.
You have some cities that were devastated by the COVID, that had no more law enforcement working for them, that had fire departments that were completely out and they couldn't go on, EMS providers that didn't have any EMS personnel to be able to go into the homes. But that's where we came in. Because of that, and everybody, the communication that we had, we were able to fix a lot of those problems that if we didn't have that communication, we may not have. Just the decisions that our county judge made were very tough decisions. A lot of people didn't agree with some of the decisions, but all of those decisions that were made for the benefit of the county.
I think, like, as an employee, we had a lot of work. Like I said, like going through the reports, especially the death records. I know that made a toll on like a lot of people just going through them. And then the long shifts, there was days where we would stay, like I said, midnight. We worked Sunday to Sunday on the weekends. It was just constant work. But then at the same time, we were exhausted.
My staff, they were talking to family members. They were positive, and they were talking about, the grandparents, grandchildren, and all kinds of family members. They were talking about someone that they just lost, and a lot of it is based on the fear that was going through them. It was either one, I'm positive, but I don't want to expose anyone else. I live with my grandma, or I live with someone that has these health conditions, or two, they did, and the person passed. And so the mental health aspect is going to be there for a long time for a lot of people.
The hugest impact to me personally was the loss of life. I experienced it as I lost my best friend to it, and then just seeing friends and family members who lost their loved ones. That's probably the worst part about this entire deal is, all these deaths that happened over the past 2 years have had a large impact on me personally, and it's been sad to say the least. But we continue to move forward, and hopefully the next time something like this happens, we'll be better prepared.
I could never see myself in a position where I could be upset that we did things wrong, because this is the first time we ever gone through it. But that it was a situation where if I was upset, it's because of lack of communication. And so I think we learned how to deal with each other's personalities and our strengths and weaknesses, and just move forward and understand what everyone's going through. So yeah, I mean, my staff is what keeps me going too.
Everybody who had anything to do with anything during this pandemic, we were one team, one county with one goal. And I think working together with those open lines of communication is what made us successful.
I remember one weekend we started developing these mass vaccination clinics, doing it at Los Fresnos. They were unbelievable in helping us. And we were working our way up, 500 to 1,000, 1,500 to 2,000. And one day in the second month, I want to say, or maybe third month, we did 6,000. And that was way too many. But we did it. And I remember hearing the news that weekend that in LA at Dodger Stadium, they did 10,000. And they were making all this great big deal about it. I'm like, hey, here in Cameron County, we just did 6. And not that we were looking for attention, but it just showed me the quality of the individuals that we had committing themselves to help.
Nobody ever sees what happens behind the scenes. But I can tell you one thing, our county judge loves the citizens and will do anything possible to save our citizens. Our public health director, same way. Our emergency management coordinator. Everybody who has worked with this county, I have seen personally give up personal time and sacrifice to do everything possible to make sure that the citizens of this county and any county around us was as safe as possible.
It's been said that, public health, we're victims of our own success, because, everything's fine, no one knows about us, and we're okay with it, obviously, but the minute something goes wrong, we start screaming, where's public health? Well, here we are, we've been here, and so we're just going to continue doing that. And so, and sometimes I think we did such a great job in Cameron County. I always tell everyone, residents of Cameron County, they're lucky to live here. Very lucky because everyone came together. And people don't realize is that public health has always been here. We've always been here. It's not something that oh, COVID happened, let's build the health department. You know, it wasn't like that.
I'm very, very proud of everybody that's worked with us and had a hand in dealing with COVID here in our county. There are too many names to mention, but from the bottom of my heart, I want to thank all of them, all of the healthcare professionals, all the public health workers, all of my emergency management staff, the first responders, the elected officials, the administrative staffs for all the elected officials, the community members, the essential workers, are everybody, law enforcement, everybody that had a hand to get us to this point. It's too numerous to mention, and if I have failed to mention, please forgive me. But I'm thankful to everyone that had a hand in getting us to this point, and is going to help get us past the finish line as we create a new sense of normalcy for all of us here in Cameron County.